Hello, everyone. My name is Shaquila Douglas, Consumer Mobility Coordinator with Harris County Rides, and we are back with another Spotlight Agency interview. Harris County Rides collaborates with various organizations throughout the county, and we want to make sure that we take our time to highlight the work that they are doing in our community. So today, I am joined by Alice and Suzanne with Area Agency on Aging. Good morning, ladies. Thank you so much for being here.
Good morning. Thank you for having us, Ms. Douglas. It's our pleasure.
Good morning, Ms. Douglas.
So tell us a little bit about who you are, what do you do, just like a short little bio about some of the work that you do in your organization.
Okay, so I'll start off. So we are the Harris County Area Agency on Aging, and there are 28 AAAs in the state of Texas, and we're the largest. The goal for Area Agency on Aging is to make sure that older adults are able to age in place in their homes comfortably. Our AAA is unique because we actually fall under the umbrella of the health department. So we have a plethora of services that we offer. So with the Harris County Area Agency on Aging, our front door, you would encounter information referral assistance staff, and then we have certified benefits counselors. We have care coordination services, which provide in-home support services such as personal assistance, in-home respite, adult daycare, emergency response. We have incontinence supplies, legal services, dental, hearing, vision. We have an array of services and transportation services. All of our services are meant to make sure that older adults and caregivers get what they need to age in a community comfortably.
Amazing. Y'all do everything.
And I missed a lot of services, I'm sure, because it's so many services. That's why I encourage the audience to go to our website or just call our intake number so you can find out more about what we're doing.
Amazing. Alice, tell us a little bit about yourself.
Hi, my name is Alice Moore Baines, and I am the Transportation Coordinator for Harris County Area Agency on Aging. And what I do is make sure our seniors get to where they need to go.
Yes, you do. We work very closely with Alice every day, working to get people transportation back and forth to their medical appointments. So I'm so grateful that you guys are here with us today. And honestly, in this first minute or so, I'm even learning more about what you all do. So can you tell me a little bit about the transportation, the specific transportation work that you guys do over at AAA?
Yes. Basically, what we do is we provide services for seniors 60 and older. We assist them with getting to their non-emergency medical appointments, and also to the pharmacies, the grocery stores, little places so that they could get out of their homes and be able to be mobilized safely. And I express that word safely because there are so many unsafe transportation processes. So we want to make sure that they get to their destination safe. And that's kind of what we do. And we also be that person that they can reach back to if there's a problem. And partnering with Harris County Rides allows us to have that opportunity to kind of intervene if there's a situation and have a collaboration of people who are helping them.
Yes. And you know what, for our mission, one of our biggest things is we want to provide safe and reliable transportation. Yeah. So can you tell me a little bit how transportation fits within your organization's mission?
Yes. One of our missions is to make sure that our seniors can stay in their home safe, be home, and not have to be in an institution. So us being able to provide that service to get them to the appointments that they need, and to ensure that they're safe and that they can be mobile, that they're not stuck at home and being sick and can't get to doctor's appointments or can't get their medication or can't do the things that they need to do, which will increase their anxieties, even because we get calls in where clients are kind of anxious because they need to get to that doctor's appointment. They need to get that medication. And so what we do is we provide that service to ensure that they get that. And we give them a live person that they can actually talk to.
Yes.
I'd like to echo what Alice said in regards to providing the non-emergency transportation and transportation to the congregate meal sites, it ties into preventing the isolation as well.
Yes, yes. And you know what? For us too, like that's our kind of motto is keeping Harris County moving. Because for a lot of people, when you have that transportation barrier, it's hard, like, you know, you can't go anywhere and it's hard to get to medical appointments. And then that decreases, you know, the well-being of a person, like physically and mentally. So I guess my next question is, what is the biggest barrier that you have seen when it comes to transportation? And then how do y'all work to overcome that?
Well, one of the biggest barriers that we found is that access of transportation. So I guess in the recent year, we've had challenges with having enough access to transportation. Now, we could transport get our clients moved, but we don't have that enough vendors to come in to actually help us to get them moving and get them to where they need to be on time and in an efficient way. So that's been our biggest challenge, but how we was able to overcome that is to continuously communicate and collaborate with Harris County Rides. And whenever there's a situation and issue, they work together with us as a team to work with our vendor to ensure that we're still moving our seniors in a timely manner and in a safe manner. So that's kind of how we've overcome it, by continuously collaborating with our partners.
Yes. And it's really a spirit of just not giving up, you know, especially working within like public transportation. That in itself can be a barrier, you know, and trying to navigate how to go around, how to figure out how to get to where you need to go. And then on top of that, as y'all know, we have been in this ongoing pandemic, which has really kind of turned a lot of people in their lives and their routines upside down. But our partnership has been able to continue, and we've been able to operate, and we've even expanded some transportation throughout our county with our partnership with you all. So how did you guys learn how to adapt to COVID-19 and the way that your organization works to keep the community going?
So one of the things that we've done, you mentioned the word partnership and collaboration. Those are key. We were able to move forward with providing transportation in this state of the pandemic and other services because of the collaboration we formed through years. Example, I know we've had a partnership with Harris County Rides for over 20 years. It's that partnership, it's the collaboration. It's been other agencies within our service area for other services that we've partnered with. So when COVID happened and we had to look at a new way of doing business, a new way of delivery of services, and a new way of meeting the needs of our older adults, because of the collaboration, and we were able to just pick up the phone and make some calls because we all share the same interest with making sure that we meet the needs of the citizens in Harris County. So I would stress that to anyone listening and any agency, partnership is important.
Yes.
Because that's what we're able to do what we've done. And Alice was able to move forward with some other stuff as well pertaining to transportation. Alice, would you like to share?
Sure. Like, we were able to partner with an organization called Rockwell, and they were able to give us funds so that we can move our seniors and our constituents to getting tested, getting vaccinated. Through the partnership with Harris County Rides, they were able to provide that services for us and be that partner that would allow us to move these clients and make sure that they were tested and vaccinated in the midst of this COVID process. So I think that, again, we're continuously talking about this partnership thing, but I don't know what we would have been able to do if we had not had this partnership where we could say, oh, now we have a pandemic, and now how do we work together as a team to work and still provide the services that we need? And so through Harris County Rides, their willingness to work with us to move our clients to get this tested and get vaccinated was really an awesome process, and it was flawless. So,
yes. Which is actually like super surprising on my end. I mean, nobody has been through a pandemic before, but seeing how partnership transforms communities and transforms attitudes, because I think a lot of it is us trusting each other to get the work done and to do, be a benefit towards the community. And then the community in turn trusts us to be able to get them to where they want to go. So the way that we've grown throughout the pandemic, like this specific partnership is just really super special. So I know the clients and the people that we're serving and that we're helping really do, appreciate that. So because y'all work so closely with clients and community members, what would you say that you've seen benefit the clients that are in your service area? Like, how has this partnership benefited the clients that you work with, and why do you think that's important that we do this?
Again, I stress the fact that we're available for them. Mm-hmm. And that's how the partnership in the process was able to benefit our clients, because they have a live person to call and say, this is what I need, this is what's going on, this is what has happened. So how can we help buffer that kind of situation for them so they're not anxious or they're not stressed? And then the partnership with Harris County RISE, when we have a situation, we're able to call Harris County RISE and say, this is the situation. We have the subject matter expert, Vernon, and we'll call her and she'll connect us to you, Shaquila. And just having that person, seniors in our community, they want to talk to someone.
Yes.
They want to let them know what's their frustration, what's going on, and our ability to hear and listen to that and navigate with them. I think that's the benefit that we have. And that's what I would stress. Just be available.
Yes, I agree. Answering the call center sometimes, a lot of times the seniors will call and they start off talking about like their transportation issues and where they need to go, and then it's like I look up and we've been on the phone 15 minutes because they just want to talk.
That's right.
And when you're willing to talk and to just hear them out and to really listen to what it is that they're going through, that makes such a difference in the people that we work with. And I think also you've been stressing having a live person being able to talk to, they don't want you, like you said, they don't want those automated messages. They don't want to dial through a whole bunch of menus and then only be able to talk to a robot. So I think what we're doing in this partnership is innovative, but also it's geared in a way that relates and is accessible for the community that we serve. So wow, I mean, I've learned a lot about what you guys do, and it's amazing to hear on your side how you guys feel about this partnership, because I'm like, oh, I love Area Agency on Aging. Alice is wonderful. They're quick, they get our clients moving. So for anyone who may want to talk to you, talk to somebody else, learn about the different programs and stuff, where can people learn more about Area Agency on Aging?
So there's several ways. They can either call 832-393-4301, or they could call our long distance number, which is 1-800-213-8471. And then we have our website, www.houstontx.gov/health/aging/.
Amazing. Is there anything else that you guys want to leave us with? Anything you would like to say to the community? I know I kind of put you on the spot.
Well, no, because we love our community, so we're never going to be short for words and things that we want to say to them. And the thing that I would just love to say is that reach out to us. We help. And that's what our Harris County Area Agency on Aging is about. It is helping. And if you would reach out to us and call the numbers that Ms. Suzanne has given you, I can guarantee you we will navigate you to the area that you need to get the service that you need. Not just transportation, but all the services that we provide. So we're an agency, and I believe we have the most awesomest staff who love the community, and we give heart to our community. So if you reach out to us, we will do our best to service you.
Yes, and I echo what Alice has shared. The staff, they're passionate. about serving older adults and caregivers and veterans, just serving the community. So just reach out to us, because it's so many services that we didn't touch on. I know the focus was transportation, and I kind of gave just a snippet of some of the other services that we provide, but there's so many others that we left out. And the bonus is we have certified benefits counselors that will help you navigate through the system of other services that may be needed, along with the care coordination team, the case management team. Yes. So give us a call. 832-4301.
I'm sorry, I cut you off. Can you repeat that number one more time for them?
Okay, 832-393-4301. Give us a call, and especially if it's for transportation, you'll have a friend with Alice Moore-Baines, because she's phenomenal.
Thank you, Suzanne.
She is phenomenal. You guys have a phenomenal team. And again, I really thank you guys for taking the time out to talk to us, to speak to the community. And like they said, reach out. We at Harris County Rides, we value this partnership and all the other partnerships that we have. So if you're interested in learning more about our partnership with Area Agency on Aging, please feel free to call Harris County Rides at 713-368-7433. Or you can visit us at our website, rides.harriscountytx.gov. Thanks for listening, and we'll see you again for our next agency spotlight.
Thank you.
Thank you.